Welcome to the Ambulatory Healthcare Today podcast, hosted by the NextGen Advisors. Accelerate your success with insights from a multidisciplinary team of healthcare experts as they discuss an array of topics. These timely discussions can help you better navigate the challenges of running your ambulatory care practice. Here is your host.
Happy New Year and welcome to the relaunch of Ambulatory Healthcare Today, a podcast hosted by advisors from NextGen Healthcare. After a brief hiatus, we're so excited to be back with everybody once again as we explore the intersection of healthcare and technology. For those of you I haven't met, I'm Dr. Bob Murry, a practicing family medicine physician and also Chief Medical Officer at NextGen Healthcare, a leading provider of healthcare technology and data solutions. And I have the great privilege of serving my own community in New Jersey as a family physician. Today, I'll be speaking with Jeremy Dixon, our Vice President of Product Management here at NextGen Healthcare. Jeremy, thanks for starting the new year with me on the podcast. Why don't you tell everybody a little bit about yourself and your role at NextGen?
Yeah. Hey, Dr. Bob. Great to be with you and happy New Year to you as well. Really excited to be on the show with you today. So a little bit about myself is that I live in Nashville, Tennessee. I've been a part of the NextGen organization now for 5 years. I started off in a product management role and now oversee our entire team of mobile product managers, which includes 5 PMs here at NextGen. And we're really focused on making sure that we deliver an awesome and delightful experience for our providers so they can practice medicine using iOS devices. So that means that they have accessibility right at the palm of their hand, and the EHR kind of fits in their pocket for a seamless clinical documentation experience.
Got it. Yeah. And because mobile, you said you're a mobile product manager. Mobile, of course, is the app for providers who use NextGen, and it's very tightly integrated with the electronic health record, both to view the patient's record and also contribute to it in new ways, as we'll talk about today. But let's maybe jump into today's topic. Everybody's talking about artificial intelligence, AI. Arguably probably the biggest buzzword in 2023 last year. And I think it's going to continue to be a big part of 2024 conversations that are happening in many industries, including healthcare ours. So share a little bit about what your team is doing to integrate AI into NextGen's healthcare technology.
Yeah, for sure. I mean, AI is definitely a big buzzword. And now that you've seen ChatGPT kind of bust onto the scene, it's becoming commercially available to a lot of products and other industries. And we're certainly focused on making sure that we can harness the power of AI to really essentially tackle the burden of physician burnout. That's the area that we think we can make the biggest impact right away. There's a survey out there that's pretty impactful in that the American Medical Association is reporting that 63% of physicians report feeling emotionally drained at least one time a week. So it's a big problem that we have to get around. In early October last year, we actually unveiled our first AI product called NextGen Ambient Assist. And essentially what this does at a really high level is that it allows the provider and the patient to have a very natural conversation in the room. It listens in and it produces a summary of that encounter. So the provider doesn't have to spend time documenting with their keyboard or dictating after, or even having a scribe in the room. It creates this really unique opportunity for providers to have somebody kind of behind the scenes that's not a person that's documenting for them on their behalf and creating a beautiful summarized note and really hopefully leading to that decrease in documentation time and burnout.
Yeah, I mean, I've been using Ambient Assist, as you know, and we'll get into that in a little bit. But at NextGen Healthcare, we're very heavily focused on provider burnout. It's a big issue and a challenge for the healthcare technology community. I think if we're going to achieve our corporate goal of better healthcare outcomes for all, a huge part of moving towards that goal is to be able to make things easier for the physicians and the providers, and kind of let them regain the pleasure and the joy of experiencing the practice of medicine rather than a lot of this administrative and documentation burden. But as I said, I mean, as you know, Jeremy, I started using Ambient Assist, the ambient listening technology that's built into the provider app, NextGen Mobile. I began using it well before it was generally available last October, and a huge fan. All kinds of reasons. I mean, at a very high level, right? It means that I can just pay more attention to the patient because I don't have to be typing on the computer because whatever is said out loud, at least a summary of it is immediately available. The way that it's integrated into mobile, into the EHR, maybe 30 seconds after I tap the end visit button, the conversation that the patient and I had it turns into the start of my note, and that has all kinds of advantages that we can get into more. But for those who weren't aware, NextGen held our annual user group meeting, our UGM, at the end of 2023. It was in Orlando in November. We always love UGM, very special time to connect with clients and hear what's going well, hear what's not going well, for perhaps, and to find out what is excited about them and show them what we've been working on. And Ambient Assist, I think, had a big impact, a big reaction on user group meetings. So Jeremy, I mean, what was your experience being there and being the one who had been at the vanguard of introducing this product to our clients?
Yeah, no, it was certainly exciting, Dr. Murray. I mean, there was a lot of providers who came up and said, "Thank you for bringing a product like this to market. It's definitely going to help us out." We had a lot of people come into our big demonstration booths that were set up, and a lot of kind of smiling faces and people who were shocked with how good the technology already is, considering this is version 1 that just came out. And there's a long way for us to go to make it even better. But really, really excited to see early adopters come on, see the value immediately, and kind of get that benefit of not having to worry about documentation after work or going home and doing what is called PJ time in kind of the provider world, where they stay up a couple hours after the family's gone to bed and they're finishing up their notes throughout the day. I think it's also important to touch on, and Dr. Murray, maybe you have some opinions on this too, is that we're not really automating the documentation process, at least not yet. We're really focusing on augmenting the provider. And I think that's a really big distinction that companies need to be, kind of careful about as AI is gaining our trust as humans. We can do certainly a lot of the heavy lifting, but the provider is going to have to then go back and verify and trust that the system is operating as it needs to, and it's not putting falsified information or things that may not have been correctly stated in the exam room. But what we found so far is that it gets you to a very accurate place, and the heavy lifting is really done without you having to intervene in that conversation. The other thing that we've heard too is that it's training providers to talk a little bit differently in the exam room. So they may provide more information to the patient because they know this is listening, but it also leads to a better, more interactive experience with the patient, whether it be them getting more information about the diagnosis or the care plan after. And that's really been kind of one of the surprising benefits that we've seen. And interested to kind of hear your take on a couple of those things that I mentioned, because I think there are a couple unexpected things that came out of releasing Ambient that we didn't quite think of when we originally brought the product to market.
Yeah, those are great points, Jeremy. Maybe I'll kind of start with the last one because I do find myself saying maybe more out loud or being more explicit in my out loud thinking about what I think is going on with the patient and then what we're going to do. Because the little lazy person inside of me knows that if I say it out loud, then I'm not going to have to document. I'm not going to have to type it into the EHR. But your first point is probably a bigger one. I do think that there's, for some people, a little bit of fear of AI, both for society in general, or perhaps specifically for healthcare. And so the way that NextGen has incorporated the concept of ambient listening into a workflow that it's just very, very useful for the practicing clinicians, I think is really special, because after the AI comes back with the note, it's available for you in the app, and you'll see that the note, I mean, is pretty simple. It does a very nice job of kind of not reproducing the chit chat and all the friendly conversation that you might be having with your patients. It's really focusing on the medical stuff, but it's a simple version of the encounter, and it's really inviting you to add in your medical thinking, your medical decision, your expertise on top of that kind of basic version of the conversation, or that's in the form of a note that happened in the exam room. And that's very, very helpful, because while Ambient Assist will completely nail a lot of very simple encounters, and there's really nothing that I need to add to the documentation, the fact that every time I'm looking at it and thinking, okay, so what do I need to add to this note, or what do I need to go into a little bit more detail about to make sure that the next person reading this note really knows what I'm thinking, not necessarily what I said, and what other nuances or complexities may be going on that are affecting the reasons why this is what I think that is going on, or what the treatment plan is. And so Jeremy, I know that there's other vendors out there that are offering ambient listening technology, both EHR vendors and even standalone vendors. And I'm curious to know what do you think are some of the differences between the way that your group implemented it and some of those, and then why did you choose to do it the way that you did?
Yeah, that's a good question. So, I mean, I think number one is certainly the direct integration back to the EHR and our template sets and the core clinical workflows. That's really where I think we've separated ourselves from the competition today. A lot of the vendors out there today have great technology and totally respect what they're doing, but they lack the integration that eliminates the need for what we call copy and pasting back from one system into another. So immediately that's kind of the end result. But looking further ahead, the team is working on extending out our ambient capabilities more. So we're getting into building out specialty models that are a little bit different for folks who do internal primary care medicine. There will be different models for our specialties like orthopedics and ophthalmologists, et cetera. So we're really thinking through how does this technology work with the different specialty providers out there, because a SOAP note is a SOAP note, but the way that different providers want that written is very nuanced and subtly different. So we're working with our team and our customers to understand what are those key differences and how do we make these models very specific and fine-tuned for them. And then beyond that, we're also working on new AI models that will be coming out later in the year to help predict things like diagnosis coding, orders, medications, and even some of the charge codes. So we'll be augmenting those workflows in future versions. So a lot of exciting things to come on the near-term horizon.
Yeah, I mean, I certainly can't wait for some of that stuff. And it's been fascinating for me, because I've been doing healthcare technology for a long time, and I think prior to a year or two ago, when people thought about, well, how is AI gonna hit healthcare, right? It was that it was going to help clinicians at the point of care make their decisions, right? Somehow it was going to be a decision aid. And that maybe still is coming, but that's actually just not nearly as useful as having the AI take away or massively reduce the documentation burden, right? Which is what Ambient Assist is doing now. And then also in the relatively near future, some of the other administrative burdens, the ones that you're alluding to, right? The need to look up, certain codes for diagnoses or procedures, or the need to click through the EHR to actually enter all those orders. All of that is administrative, burden, right? I've told you, Jeremy, and others many times that, every second that occurs between when the doctor knows what the patient has and knows what they want to do in their mind, between that moment and when everything is in the EHR, that is all a waste of time. Right. And it's fascinating to see that maybe unlike we expected 5 years ago, AI is tackling that administrative burden, that burnout burden, sooner than actually, quote, being, intelligent, so to speak.
Yeah, and that brings up another good point, Dr. Murry. One of the things that we've heard concerns, rightfully so, from our providers and particularly our IT friends is that, how do we ethically do this? And one of the things that we're doing on the front end is to ensure that all of the conversations that are happening in the room are not being recorded. So we don't store any of the audio. We don't keep it. We don't train our models on our customers' data sets. And that's really important for us because, as you know, there's some new regulations that are coming down that will go into effect at the end of this year. So we're really conscious about making sure that we're being very, very secure and tightly locking down that information and really not even storing it at all. So really, really critical to think about as AI becomes more pervasive in the healthcare industry.
Yeah, I agree. I mean, those both providers and patients' concerns about the privacy of their information and the security of who has access to it and where is it stored and all of that stuff is very, very central to the way that NextGen Healthcare, as a company, is approaching AI. And of course, we have policies around this that are in line with some of the other most responsible leaders in the industry, kind of guiding our actions and what we choose to do and not to do. All right. Well, Jeremy, we'll probably, wrap it there. Thank you so much for, chatting with me today. I am very excited about what your team has already produced, and I really look forward to this year. I think there's going to be a lot of great stuff coming out. For those of you out there that have not tried ambient listening, or in particular have not tried NextGen's Ambient Assist, I really do encourage you to do so. Don't think of it that it's going to do everything for you, but think of it as like, wait a second, this could save me some time. And maybe if I did things a little differently, and hopefully you have a good integration with whatever version you're using, this could save me a lot of time, right? It can really reduce that mental burden, that administrative documentation burden that we've been talking about. So thank you for joining our podcast today. And if you're already a subscriber of the Ambulatory Healthcare Today, then we look forward to talking with you again soon. And if you're not, maybe consider following us so you won't miss our next conversation. Until next time, thanks.
Thanks for listening to the Ambulatory Healthcare Today podcast, hosted by the NextGen Advisors. Never miss an episode by subscribing at nextgen.com/podcast. To see a list of products and services tailored for ambulatory care practices, visit nextgen.com.